I am Dr. Ashan Abeywardene, consultant orthopedic surgeon. I'm UK qualified and specialized in Australia in the fields of knee, hip and shoulder surgery, inclusive of minimally invasive and arthroscopic surgery. On my return to Sri Lanka, together with Durdans, I created a subspecialty center of international standards in the fields of knee, hip, shoulder and sports orthopedics. In the field of knee surgery, knee replacement, especially navigated knee replacements, are done at Durdans Hospital. In the field of arthroscopic surgery, ACL reconstructions, PCL reconstructions, and all other arthroscopic repairs of tissues in the knee are performed at Durdans Hospital. The most important is stem cell grafting, which is a very novel therapy worldwide at present, and that is performed at Durdans under my hands. Here at Durdans, we have maintained world-class standards in the fields of arthroscopy and arthroplasty surgery. Currently, Durdans is the only center which has navigated knee replacements as well as stem cell grafting for cartilage damage. I am the orthopedic surgeon for the Sri Lankan national team as well as members of many other national sports teams. Some of my former patients are Muttaya Muralidharan, Kumar Sangakkara, Charit Asalanka and Dushmanta Chamira, as well as several other members from other national sports teams. Here at Durdans, I perform navigated knee replacements, and for arthroscopic surgeries, I do ACL reconstructions and PCL reconstructions, as well as other ligament reconstructions, also meniscal repairs and stem cell grafting for cartilage damage. And for shoulder injuries, I perform Bankart repairs for shoulder instability and rotator cuff repairs for rotator cuff damage and tears, and shoulder replacement for severely arthritic shoulders. And for hip injuries, I perform arthroscopic labral repairs, and when there is severe cartilage damage in the hip, I perform partial or total hip replacements.
Hi, my name is Ismail. I'm from the Maldives. I was standing on the side of the road when I saw a three-wheeler coming crashing onto me, I thought. I turned to get away from him, and I had a sharp pain on my right knee. Then when I came back, I rushed to Durdans Hospital to see Dr. Ashan. He did a few x-rays and an MRI, and he suggested that I do an arthroscopy. And the procedure itself doesn't take that long actually. So obviously I went home, I read it a bit, and I was very comfortable. Then recovery, I should say, it took say 3 weeks to be almost normal on my feet. I feel great actually.
Hi, my name is Abdurrahman. I'm from Kandy, and I'm a student from the International Islamic University in Malaysia. 3 months ago, I was playing futsal. I was running. I made a quick twist while running, and I heard a loud pop in my knee. And once I got it checked out, I found out that it was a complete ACL tear. I heard about Durdans and Dr. Ashan from a friend of mine. Once I had my appointment with Dr. Ashan, I was happy and I decided to go forward with it at Durdans. So the surgery itself, it was around 2.5 hours, if I'm not wrong. It started around 10:30 a.m. and ended around 2. So the bottom half of my body was anesthetized. I had spinal anesthesia, and the surgery I did not feel any pain. I could not feel anything because I was anesthetized, and it went smoothly. Well, I'm able to walk now. I was able to get off crutches within 3 to 3.5 weeks. Now I'm doing my physiotherapy. But in terms of normal life and walking normally and moving about, 2 to 3 months, and I would be able to get back that, inshallah. Yeah.
Hi, I'm Ahmed Atif here. I'm an electrical engineering student in Taxila, Pakistan, and I'm a soccer player. I recently had an injury on my knee. I came back to Sri Lanka just to recheck up and do my surgery here. Family physiotherapist, he recommended me Dr. Ashan Abeywardene to be consulted. He said that there are two problems, which is one ACL reconstruction and meniscus complete damage. I found that I do not need to remove my damaged meniscus. So I was happy, and finally I have been ended up with the surgery here at Durdans Hospital. It's been 3 months since my surgery, and within the next 6 months, I hope to make a full recovery.
මම හිටපු ජාතික කණ්ඩායම සහ අන්ත සමාජ තරගවලට සහභාගී වුණ රග ක්‍රීඩකයෙක්. තරගවල අතරතුරදී මගේ ඇති වූ ෂෝල්ඩර් ආබාධයක් ඇති වුණා. ආබාධය අනතුරුව මම ඩොක්ටර් අෂාන් වෙතට යොමු වුණා. මොකද කාලයක් තිස්සේ ඩොක්ටර්ගෙන් මම ප්‍රතිකාර ලබාගෙන තියෙනවා සුළු සුළු ආබාධ වලට. අනතුරුව ඩොක්ටර් රෙකමන්ඩ් කරා MRI එකකට යන්න වෙනවා කියලා. MRI එකේදී පෙනුණා මේ බැංකාට් රිපෙයාර් එකකට යන්න වෙනවා ෂෝල්ඩර් එක නැවතත් යථා තත්ත්වයට පත් කරන්න නම්. පැය 3ක පමණ ආතරොස්කෝපි එකක් නිර්දේශ කරලා තිබුණා. අනතුරුව සර්ජරි එකෙන් පස්සේ මාස 15ක පමණ ලොන්ග් පීරියඩ් එකක් ගියා රිකවර් වෙන්න. ඔක්කොම මූවමන්ට්ස් සමග නැවතත් මම සියලුම ක්‍රියාකාරකම් වලට පහසුවෙන් යොමු වෙලා තියෙනවා.
I am Javier Mateo Sagasta, and I've been living in Sri Lanka for 8 years. I love sport and I love surfing. I overdid it too much surfing, and then I started having problems with my shoulder and deep pain. So I was looking for some help, and I was referred to the Durdans hospital, and then there I met Dr. Ashan, who looked at my problem and then recommended to make an MRI. The result of the MRI showed that I had two problems. So after analyzing the problem, he recommended arthroscopic surgery on my shoulder. Then they took stem cells from my hip and then re-injected them in the shoulder. This allowed to create this clot that helped the cartilage to regrow. So the surgery lasted like for 3 hours or so, and I was discharged the same very day of the operation. It was quite painful for a while, but slowly and progressively and with physiotherapy I've been progressing and improving. So my hope is that working hard with a physiotherapist for the coming 2 to 3 months, I can be fully back in business and surfing back again as I was before.
Knee preservation is always better than knee replacement. Therefore, early management of knee injuries with precise latest techniques such as stem cell grafting can avoid the necessity of knee replacements. Here at Durdans, we have many therapeutic options and procedures on par with international standards to treat a wide array of joint-related injuries. However, early treatment of injuries is the better option to purely pain management and letting an injury get neglected. Most joint injuries get progressively worse with time. Therefore, it is always better to seek early treatment before the problem gets any worse.